Oh, yes. Suzette, are you muted by any chance?
No, but the sound dropped out for a minute.
Okay,
so.
we can hear you fine. If you'd like to go ahead and make a few moments of comment, please.
Yes, thank you. I appreciate that. I know I'm the only geophysicist on this panel, and I wager I'm probably the only geophysicist in the room or on the phone. So the past day and a half has been very informative for me and very thought-provoking because it's not within my general personal scientific research realm. However, it does intersect with work that is occurring in the USGS, and so I'm going to approach my comments from that perspective. We hear a lot about how those in the popular literature about dietary choices and lack of exercise, genetic predisposition as established factors fueling the obesity epidemic. But I think the discussion yesterday about the body of research that's emerging around environmental exposures, including the endocrine disrupting chemicals, the EDCs, and how they play a significant role in risks associated with obesity and other health challenges is something that plays very well into the kind of research that we do at USGS, which is focused on environmental conditions and environmental causations and factors. So we recognize that there are many unknowns regarding the extent to which the environmental chemicals may be contributing to the current epidemic, but I think that there is a lot of research underway and a lot of new challenges that I learned about over the past day and a half that we can address. I also think that recognizing the potential involvement of chemical exposures in the development of obesity can also reveal new avenues for risk reduction and prevention. Interventions that prevent or limit exposures to toxicants across a lifespan can be a valuable health strategy. And it's intriguing to consider this strategy and how it might prove helpful in the obesity epidemic. And I say this knowing that many of the research gaps that need to be addressed are really not unique to obesity research. Continued increases in types and number of contaminants and our limited understanding of the mechanisms by which these chemicals not only cause adverse health effects, but also the way the chemicals may interact in the environment to provide cumulative effects, really do present some ongoing research challenges. New and better approaches and methods, I think, are also needed to measure the presence of chemicals in the environment in order to assess their potential ecological and human health effects. So some of the challenges I heard about over the past day and a half that I think we are making progress on and we are focused on, but still have some work to do to move them forward, include the potential health effects of chronic exposures to extremely low, that's the subpart per billion concentrations, the potential increased vulnerability of some populations, such as the elderly, early life stages, or those that have other complicating health factors. The fact that exposures in early life stages cause impacts much later in life or in subsequent generations, and how that process occurs and continues through generations. Again, the exposure to mixtures of environmental contaminants that have unknown combined effects. From our perspective, which is really looking at the environmental conditions and environmental factors, a major research challenge is identifying and characterizing the environmental drivers of exposure. So exposure to, as well as the fate and transport of environmental chemicals, is affected by both natural and anthropogenic changes to the environment. And with the increasing societal demands for land and natural resources and changing needs for resource consumption that are driven by economic prosperity and the lack of economic prosperity, the differences in demographics across the world, those lead to the choices associated with that lead to environmental change. So the natural earth processes, climate trends, and related climatic events further compound the changes that happen on the landscape. So as I mentioned, USGS is a natural resource science agency, and one of our strategic focus areas is environmental health. But our science specializes in factors at the environment and health interface, that is, characterizing the interactions among the physical environment, the living environment, and people to understand how processes affect human, wildlife, and ecological exposure to environmental disease agents. We've really focused recently on working on the endocrine disrupting chemicals. We spend approximately $5 million per year in appropriated funds on EDC-related research. But we also have strong collaborations with other Department of Interior agencies, the EPA, USDA, the Corps of Engineers, as well as state public health and agricultural agencies, NGOs, and universities. So the actual figure that is dedicated to this research is much, much larger than that $5 million. We heard yesterday that somewhere in the neighborhood of 800 compounds are known or suspected EDCs, and that widespread presence of measurable levels of EDCs in human tissues in conjunction with the opportunistic studies of accidental high-dose human exposure and supporting causation studies in animal models and wildlife studies raises concern for potential detrimental health effects in humans at levels that are found in the environment at environment level exposures, that is, not increased concentration of contaminants or toxicants in this particular case, but at baseline levels. In 2014, USGS developed a USGS National Strategy for Research on Endocrine Disrupting Chemicals, and that strategy focuses our efforts on the science related to the occurrence, exposure pathways, and effects of EDCs on natural resources, including both terrestrial and aquatic wildlife. But I think that there's some of the research challenges and research directions that are identified in that strategy that can intersect very well with the work that the public health sector is undertaking in this effort. So the research needs that we identified in that strategy include the systematic evaluation of sources, distribution, and fate of EDCs in the environment, the identification of routes of exposure of ECDs to fish, wildlife, and humans, studies of EDC accumulation in animal and human tissues, research into the effects of simultaneous exposure to mixtures of chemicals, investigation into mechanisms of action by which the EDCs can cause adverse effects, improvement in analytical techniques, laboratory methods, and biological assays for identifying EDCs in the environment, investigation into lesser studied endocrine pathways involving metabolism, behavior, fat storage, bone development, and immunity, and our studies are focused in those areas in fish, and the identification of new potential EDCs. So I think that those challenges that we've identified as a research strategy specifically for EDC can, as I said, connect very well to the kinds of challenges that I heard articulated over the last day and a half. And having the national environmental sampling strategies that the USGS maintains for both water, soil, and geologic formation studies of chemical constituents, I think can help provide some additional information to this discussion beyond the walls of the laboratory, but out into the environment to be able to understand the distribution and concentrations of these chemicals in the natural environment. So with that, like I said, for me, this has been a very educational day and a half, and I certainly look forward to further discussions and to working with public health partners in order to be able to provide some comprehensive successes in dealing with these issues. Thank you.
Suzette, thank you very much for adding the additional insights. We now go to John Rogers.